What if your morning sore throat was a whisper of something far more sinister? Throat cancer often begins quietly, unnoticed. Join us as we navigate the often misunderstood realm of throat cancer symptoms. We're breaking down 8 key signs, providing you with essential knowledge to stay one step ahead. Stick around to arm yourself with information that could not only save your life, but also help you advocate for your health in a world where early detection is key. Sign 8. Persistent sore throat. A persistent sore throat, often easily dismissed as a minor irritation or a consequence of a common cold, can, in fact, be a subtle yet significant early warning sign of throat cancer. This symptom, when it lingers for an extended period, often weeks or even months, transcends the realm of a mere inconvenience. It becomes a critical indicator that something more serious may be affecting the delicate tissues within the throat. Throat cancer, in its initial stages, can lead to inflammation and irritation in the throat. This is not the typical sore throat that one might experience during a cold or due to allergies. It is more persistent and does not respond to the usual remedies that typically alleviate a sore throat, such as rest, increased fluid intake, or over-the-counter medications. The persistence of this symptom is what makes it particularly noteworthy. A sore throat that refuses to subside despite these standard treatments is a red flag, signaling the need for a more thorough medical evaluation. The reason behind this prolonged sore throat in the context of throat cancer is the abnormal growth of cells in the throat, which can cause continuous irritation and discomfort. As the cancer develops, it can lead to more pronounced symptoms, but the initial persistent sore throat is often the first clue. This symptom is especially concerning if accompanied by other signs, such as difficulty swallowing, voice changes, or unexplained weight loss. Sign 7. Voice changes or hoarseness. Voice changes or hoarseness, the 7th sign, holds significant importance in the context of throat cancer. Unlike the temporary hoarseness experienced after yelling or a viral infection, the hoarseness associated with throat cancer is persistent and progressive. This change occurs when cancer affects the vocal cords or the nerves that control them. The voice may become raspy, hoarse, or noticeably weaker. In some cases, patients may experience a drastic change in their vocal pitch or find it challenging to speak loudly. The persistence of these voice changes is a key factor. It's not just a day or two of a rough voice, but a continuous alteration that doesn't resolve with usual home remedies. This symptom is particularly concerning for individuals who use their voice professionally, such as singers or teachers, as they may notice these changes more acutely. Clinical studies have shown that hoarseness is often one of the earliest signs of throat cancer. According to research published in the Laryngoscope, persistent hoarseness or voice changes are frequently the first symptom that prompts individuals to seek medical attention, leading to an earlier diagnosis of throat cancer. Sign 6. Unexplained weight loss. Unexplained weight loss, the 6th sign, is a systemic indicator of potential health issues, including throat cancer. This weight loss is not the result of dieting or increased physical activity. It's an involuntary reduction in body weight. In the context of throat cancer, this symptom can arise from several factors. The cancer itself can increase the body's metabolic rate, causing it to burn calories faster than normal. Additionally, throat cancer can make swallowing both painful and difficult, leading to a decreased intake of food and consequent weight loss. This type of weight loss is often rapid and significant, and it can have a profound impact on a patient's overall health and quality of life. It's a symptom that should never be ignored, as it can indicate that the cancer is at an advanced stage. A study in the Journal of Clinical Oncology highlighted that unexplained weight loss in cancer patients is often correlated with a more advanced disease and poorer prognosis. Sign 5. Difficulty swallowing. Difficulty swallowing, medically known as dysphagia, is a significant warning sign in the context of throat cancer. This condition is not just about the discomfort of not being able to swallow food or liquids easily. It's a symptom that can indicate the presence of a tumor in the throat or esophagus. Throat cancer can cause swelling or a mass that narrows the passage, making the act of swallowing challenging and sometimes painful. This symptom often progresses gradually, starting with difficulty swallowing solid foods and eventually affecting liquids. The insidious nature of dysphagia in throat cancer is particularly concerning because it can lead to nutritional deficiencies and weight loss, further complicating a patient's health. Scientific studies have shown that dysphagia is not only a common symptom in throat cancer patients, but also a critical factor in diagnosing the disease. According to a study published in the Journal of Oncology, dysphagia was present in a significant percentage of throat cancer cases, highlighting its importance as a diagnostic clue. The study emphasizes the need for prompt medical evaluation. When this symptom is persistent, as early detection of throat cancer can significantly improve treatment outcomes. Sign 4. Persistent cough or coughing blood. Moving to the fourth sign, a persistent cough or coughing up blood is a red flag that should never be ignored. A cough that lingers for weeks, especially if it's not associated with a cold or other respiratory infection, could be a sign of throat cancer. The presence of blood in the cough is particularly alarming. This symptom indicates that the cancer may have invaded the blood vessels or caused irritation and damage to the throat lining. The reason why persistent coughing or coughing blood is a critical warning sign lies in the nature of throat cancer's progression. As the cancer grows, it can irritate or invade the tissues and blood vessels of the throat, leading to these symptoms. A study in the American Journal of Respiratory Medicine found that coughing blood, medically known as hemoptysis, is often associated with advanced stages of cancer, including throat cancer. This finding underscores the urgency of seeking medical attention when experiencing such symptoms. Persistent coughing and coughing blood are not just symptoms to be temporarily relieved with cough syrups or home remedies. They are potential indicators of a serious underlying condition like throat cancer. Their persistence and severity can provide crucial insights into the extent of the disease, making them key symptoms for both diagnosis and staging. Sign 3. Swollen lymph nodes in the neck. Swollen lymph nodes in the neck are a critical sign that should not be overlooked when considering the possibility of throat cancer. The lymphatic system plays a vital role in the body's immune response, and the lymph nodes act as filters, trapping cancer cells, infections, and other foreign particles. When throat cancer begins to spread, it often first affects the lymph nodes in the neck, causing them to swell. This swelling is not typically painful, which can make it easy to ignore, but it's a significant indicator of the body's response to an abnormal process within. Research has shown that the presence of swollen lymph nodes significantly impacts the staging and prognosis of throat cancer. A study published in the International Journal of Oncology revealed that patients with throat cancer who presented with swollen lymph nodes had a more advanced stage of cancer and required more aggressive treatment. This underscores the importance of paying attention to changes in the neck's lymph nodes, as early detection and treatment can greatly affect outcomes. Sign 2. Ear pain. Ear pain, while seemingly unrelated, can be a sign of throat cancer due to the interconnected nature of the ear, nose, and throat regions. Throat cancer can cause referred pain to the ear, a phenomenon where pain is perceived at a location other than the site of the painful stimulus. This occurs because the nerves in the throat and ear are linked. When a tumor in the throat irritates these nerves, the pain can be felt in the ear. This connection between throat cancer and ear pain is not widely known, making it a symptom that is often overlooked. However, its significance in the context of throat cancer cannot be understated. A study in the Journal of Clinical Oncology highlighted that patients who reported ear pain along with other symptoms were more likely to be diagnosed with advanced throat cancer. This finding emphasizes the need for thorough evaluation when such symptoms are present, especially in the absence of other common ear problems. Sign 1. A lump in the neck. The most telling sign of throat cancer is the presence of a lump in the neck. This physical change is often the first tangible sign that something is amiss. A lump in the neck can be a sign of a tumor in the throat or an enlarged lymph node affected by cancer. Unlike other symptoms that might be easily dismissed, a lump is a physical manifestation that is hard to ignore. The importance of noticing and acting upon the discovery of a lump in the neck cannot be overstated. The presence of a neck lump in throat cancer patients is a critical factor in diagnosis and treatment planning. According to research published in the World Journal of Surgical Oncology, the detection of a neck lump significantly impacts the treatment approach, with a focus on more aggressive strategies to address the spread of the disease. We've covered the 8 early warning signs of throat cancer, from persistent sore throats to unexplained lumps. Recognizing these signs early can make a significant difference in treatment and prognosis. Remember, your health is in your hands. Stay informed and stay vigilant.